I'm Bree, and I'm the second affirmative, and I'm here to reaffirm our significance claims. Our claim was that unbearable pain patients experience that doctors cannot stop causes immense suffering, and patients are experiencing too great of pain. Now, physician-assisted suicide is, in this view by most, an act of compassion that respects the patient's choice and fulfills an obligation of non-abandonment and the decision to end one's life is intensely personal, harms no one else, and ought to be not prohibited by the government or the medical professional. Our opponents state that in our law, life is a right, and that it is going against our own laws. While that may be true, we also have a right to humanity. In an article written by Manuel Velazquez, Assisted Suicide, A Right or Wrong, he states that compassion demands that we comply and cooperate. All persons have a moral right to choose freely what they will do with their lives, as long as they inflict no harm on others, and the right of free choice includes the right to end one's life when we choose. And also, today in current hospitals, what our opponent didn't mention is that patients currently have the right to refuse their life-saving treatment. So for example, a cancer patient, if they're getting chemotherapy, they have the right to refuse the chemotherapy. And this is taken from an article, Should Physician Suicide Be Legal? And they also have the freedom to choose to end their own lives in that way. And then also, it is a significant issue because lying in our hospitals today are people afflicted with excruciatingly painful and terminal conditions and diseases that have left them permanently incapable of functioning in any dignified human fashion. They can only look forward to lives filled with more suffering, degradation, and deterioration. When such people beg for a merciful end to pain and their dignity, it is cruel and inhumane to refuse their pleas. Also, it is, for most people, to end their life is a right they can easily exercise. But there are many who want to die in these hospitals, but whose disease, they're either handicapped or their condition renders them unable to end their lives in a dignified manner. When such people ask for assistance in exercising their right to die, their wishes should be respected. And also, euthanasia is defined as the act of bringing about the death of a hopelessly ill and suffering person in a relatively quick and painless way for reasons of mercy. Also, the other benefits of physician-assisted suicide, there are actual benefits to society. One benefit is that doctors and nurses can move on to other patients that have an actual chance at living. It also relieves the suffering of the patients that are dying, and they know it was their choice to die. And another pro of physician-assisted suicide is that vital organs can possibly be saved and used to save other patients. In an article by NPR, for those with terminal illnesses, apart from the physical pain, there's also a mental anguish caused by simply watching and waiting for death to come. At later stages, terminal illnesses, organs are severely weakened, and in some cases failing. It may not be possible for them to use at that point. If we start using these organs, however, and use physician-assisted suicide before these mental illnesses can occur, this will help alleviate the long waiting list that there are for organ donations. Thus, permitting physician-assisted suicide through euthanasia will not only put the victim out of his or her suffering earlier, but may also help save more lives. Also, organ donation after death demonstrates that organ harvesting after euthanasia may be considered and accepted from ethical, legal, and practical perspectives. And the possibility may increase the number of transplant organs and may also provide comfort to the donor and his or her family, considering that the termination of the patient's life may somehow save others. For our solvency claim, assisted suicide statutes are designed to stop people from helping mentally imbalanced, despondent people leave violently kill themselves. Neither the statute nor the term actively applies to the terminally ill people who want to live, but given their imminent death, choose to die peacefully. This has been demonstrated, these types of statutes have been demonstrated in Belgium, and the Netherlands, and they have legalized physician-assisted suicide but under certain conditions. Euthanasia has to be required by conscious patients suffering from an irreversible affliction, inducing physical and psychological suffering, or psychological suffering, with no hope for improvement or for rapid spontaneous death. Request for euthanasia also has to be written by the patient or by his or her representative that has no interest in the patient's death. And the patient's psychiatric and actual physical health must be evaluated by a medical professional. And the request for euthanasia and the procedure has to be between a 30-day period. Studies also done in the Netherlands, unlike what the negative said, that it hurts the doctor-patient relationship, studies in the Netherlands suggest that patients actually found comfort in the fact that if the situation were to arise, that their doctors would assist them in death if insurmountable pain that they could not handle were to happen. And then also, in America, it is also supported. The nation's largest medical association, the American Public Health Association, supports allowing mentally competent, terminally ill adult patients to obtain a prescription medication that the person could self-administer to control the time, place, and manner of his or her impending death, with the safeguards in place, such as the ones in Oregon. Also, if the option for death with dignity, also known as physician-assisted suicide, is to anyone for any reason unappealing, they don't have to choose that. They can simply die on their own terms, wait for death to come, since they are ultimately going to die anyway.